Do you have chronic osteoarthritic pain in your fingers, wrists, shoulders, knees or ankles? Chronic or acute pain in your neck that causes headaches or migraines? Do you have trouble looking over your shoulder when you're reversing in your car? Have you been diagnosed with frozen shoulder or adhesive capsulitis? Do you have tennis or golfer's elbow? Or do you have pain when you're raising the arm? Or do you wish to combine laser therapy with shockwave therapy to get a faster resolution? Or despite seeing several therapists, your plantar fasciitis is not improving? Many of these conditions are difficult to resolve. For these reasons, at Buxton Osteopathy Clinic, we've recently invested in cutting-edge, latest laser technology, otherwise known as low-level laser therapy or LLLT, or cold laser therapy. We've made this decision because there's a growing body of good clinical evidence to support this technology. This is consistent with our mandate to offer you the best treatment outcomes using treatment modalities supported by the best clinical evidence. So how does laser therapy work? The principle behind LLLT is it stimulates tissue activity. It does this by increasing mitochondrial activity within a cell. Mitochondria drive the chemical energy needed for a cell's biochemical reactions. Mitochondria are the powerhouses within cells, and they convert chemical energy from the food we eat into an energy form that the cell can use. The chemical currency that mitochondria generate is known as adenosine triphosphate, or ATP. ATP thus provides all the energy requirements of a cell. Different cells have different quantities of mitochondria. For instance, muscle cells are very rich in mitochondria. By increasing the energy available in a cell in the readily accessible form of adenosine triphosphate, or ATP, laser light can greatly stimulate the biological function of cells in injured tissues. The main medical applications of LLLT are reducing pain and inflammation, augmenting tissue repair and regeneration of different tissues such as nerves. It is particularly effective for osteoarthritic joints, injured tendons, or acute inflamed tissue. For optimal results, we recommend 2 to 3 laser therapy sessions per week for 2 to 3 weeks. Each session lasts 15 minutes and consultations can be booked online at a time to suit you. You can ring us on 01298 214 994, or if you have any further questions, you can fill out the online inquiry form. Our online brochures on LLLT are also available to download.